Welcome to the 2022 Sizzling Summer Series, sponsored by the UNMC College of Public Health Office of Public Health Practice in partnership with the Midwestern Public Health Training Center. My name is Katie Brander. I am the Assistant Dean of Practice at the College of Public Health, and my colleagues and I are your hosts for this series. For those of you who joined us for session one, welcome back. And for those of you who are new to the Sizzling Summer Series, this is our fourth year providing innovative, timely, and essential learning webinars for the public health workforce. This year, we are focused on exploring how to communicate the value of public health. Today's session is focused on media relations for public health professionals. Journalists and media in its many forms play a very vital role in communicating timely and accurate information that will be heard and understood by our communities. So we are thrilled to welcome our guest speakers, Dr. Sherry Vale and Dr. Corey Armstrong from the College of Journalism and Mass Communications at the University of Nebraska-Lincoln. Dr. Sherry Vale is a professor and dean in the College of Journalism and Mass Communications at UNL. She's also a research fellow with the National Strategic Research Institute and a member of the Arthur W. Page Society. She's served on expert working groups for the CDC and the Food and Drug Administration. Before Nebraska, she was at the University of Kentucky and at Gaylord College of Journalism and Mass Communication. And before entering academia, Dr. Vale spent 8 years in the profession in business, marketing, and public relations. Thank you for joining us, Dr. Vale. We also have with us Dr. Corey Armstrong. Dr. Armstrong became the Associate Dean for Research and Faculty Affairs at the University of Nebraska-Lincoln's College of Journalism and Mass Communications on July 15th. So she is 13 days on the job today. Dr. Armstrong's research combines traditional and emerging media and focuses on how individuals use media to make decisions during weather events. Her studies highlight the often unmet evacuation and safety needs of vulnerable populations during weather emergencies. She was previously at the University of Alabama, the University of North Texas, and the University of Florida. And she also worked as a journalist for 10 years before returning to academia. Thank you, Dr. Armstrong, for joining us. Now, I want to note that for those of us who are rarely, if ever, in front of a camera, we can still look forward today to learning and taking away some in-demand, highly transferable skills. Although today is just a taste of the incredible media training provided by our colleagues at UNL, we know that these foundational pieces of knowledge and these essential skills presented today will equip all of us to better communicate the value of public health. Just before I turn it over to Drs. Vale and Armstrong, a couple of housekeeping items. For today's webinar, all participants will remain muted. However, we highly encourage questions and dialogue in the chat box. There will also be time for participant Q&A at the end of the webinar. My colleagues and I will be monitoring the chat and the Q&A options to ensure that questions are heard by our guests today. We also invite you to evaluate your experience via a short survey following the call. This, of course, helps us report back to our funders and improve our future calls. At this time, we are going to turn it over to our UNL colleagues, Drs. Armstrong and Dr. Vale. Thank you.
Thank you, Katie, and thank you all for joining today. We are delighted to be here and share a little bit of insight on media relations. For some of you, you really got a crash course in media relations over the last couple of years dealing with the pandemic, depending on your county and how active you were in communicating with the public. So there are some tips that we're going to bring in today that are focused a little more on how do you engage the media before you get to a crisis, before you're in a pandemic, and why that's so important. And I'm going to go ahead here and share my screen so that we do have some slides here, and there's quite a bit of content on these slides as well. And I know this is being recorded and that the slides would be available. So we did put the content on there so that you can go back and refer to it as in your time later on. So as Katie mentioned, I'm the Dean of the College of Journalism and Mass Communications here at UNL, worked in PR and marketing. I ran research centers both at the University of Oklahoma and at the University of Kentucky. I've been in academic administration for a while, teaching, advertising, PR, risk and crisis. That was really my specific area. And that's where most of my research has been, the grants and contracts I've had over the years. So that's really the perspective that I'm coming at this information with, that looking at it from how do you manage risk pre-crisis, how do you respond to mitigating those risks during a crisis for the public as well. And the ultimate goal should always be focused on how do you protect the public? So if you keep that in mind and you come from a point of care, that's going to make media relations so much easier throughout this experience. I'll pass it on to Corey to introduce herself as well.
Hi there. As they said, I am brand new. I haven't even been in the state a month yet, so but I've enjoyed every bit so far. I'm learning a lot and really enjoying it. As Dr. Vale mentioned, my background is similar to hers in that I come at it from an academic perspective and a risk perspective. Most of my research actually has focused more on the disaster communication. So I've been working with weather services and emergency managers related to how do we communicate when there's an imminent severe weather threat. And my perspective is, I was a news reporter. I was trained as a news reporter back in the day, and I did 10 years of that. So I have a sense of, I would like to say a good sense of how reporters, what their needs are, what their and what their constraints are. So I come at it in that regard. And so I think in terms of very applied kind of matter of fact kind of elements to it. But most of my experience has actually been weather related research. And here, obviously, there's a lot of weather to talk about. So it certainly keeps me busy. So I'm going to throw it back to Dr. Vale to talk about what we're going to talk about today to give you a preview.
Perfect. And I mentioned just kind of the perspective we're coming from when we're doing larger, longer media relations training. A lot of it goes into understanding ongoing risk and crisis communication. So long time ago, I worked with the CDC on the crisis and emergency risk communication guidebook, getting all of those pieces together. It's where the best practices started out. And since then, they've been tested and expanded. Right now, we're at 15 guidelines is the latest iteration of this. And if you're interested in learning more about it, we're happy to pass that along as well. This is part of a handbook. I realized when I was digging up the slides, so I can't just send you a link to an article, but I'm happy to send you the chapter out of that handbook if you are interested later on. But again, the biggest thing is that you are being strategic, that you're being inclusive, you're being responsible, and then taking corrective action in not just in your response, but also in the next level of planning that comes afterward. So today we are going to talk a little bit about just what media relations is. I understand we have folks who may be in the communication space, who may be the front office administrator, communications, social media manager, everything position, and those who are nurses who are engaged in the practice side of things, but may get pulled into communications. We really want to give you a background of what is media relations. We'll talk a little bit about the importance of the audience and understanding their needs, and then what journalists expect of you, what they want. If they're going to get your information out, they're going to have a certain level of expectation for the quality of the information you're providing. We'll then pass on, talk about making a pitch. How do you get a story in the media? And then we're going to talk about the scary part of it, which is the interview preparation. So when you're on camera, when the journalist calls, and why you need to pick up the phone when they do. And then we'll open up for Q&A. And if you do have questions along the way, feel free to drop them in the chat. Katie can interrupt us as we go, and we can answer those questions as well. Take it away.
I think, just to kind of give you a sense of what we mean by media relations, I think, as you may have noticed during the pandemic, for those of you that were working at that point, that became a crisis. So boom, it became a huge crisis. So it was immediately, boom, how do we handle this? Well, the idea behind relations is the interaction between the news and public health outlets to make that relationship smoother. So in the fast times, like during the pandemic or during a weather event, you're ready and able to negotiate that a little bit more effectively. So essentially, it's the idea of stewardship between the two. So that relationship, it's not a one-off. It's not a just when there's an event, but it's a relationship. It's a connection over time. So that interaction will help make things smoother when things are very stressful for all concerned. And again, one of the things that relationship connects with is the idea that we need to be sensitive to what are the journalistic demands, in the same way that you have demands on their job, or on your job, what are the demands that they have, and how do we make that work so that it's beneficial to both sides. So we really want to work to make it a collaborative relationship. I think good media relationships have been developed over years, months and years. And again, there's positives and there's negatives. So I think that we have some opportunities to work through it. So how do we engage the news field when things are slow, as well as when things are very stressful? And that's one of the things we're going to talk about. So to move on to the next slide, if we don't engage that way, meaning it may appear that we're not being responsive as public health personnel, or as as professionals in the field. We don't want to perceive that. And it isn't generally that you are being unresponsive. It's more of a, oh my gosh, there are so many things to do. How do I manage that? Well, we want to give you some tips on how you can manage that so it isn't as stressful for you, because we don't want you to be perceived by media or by the public as being evasive or not communicative, because that's not what we're trying to do. Obviously, we all have the same goal of being protective of the public and being helpful for the public and giving them what they need to be, to be prepared. So that PR expertise is certainly going to help kind of boost the legitimacy and the reputation of your particular departments. So we really want to think about how do we want to do that, both in the short term, again, when a crisis occurs, but also in the long term, that relationship across the board. And there's been studies that say, in fact, what I was getting at is that the perception when you say something like no comment is in fact perceived as you're being evasive and you're being unconcerned. And that's not obviously what your goals are, and certainly not the message that you want to perceive. So let's think a little bit about who our audience is. And again, there are different audiences. You have an audience from infants all the way up to, and obviously I get parents of infants and things like that, but children, you have a lot of people to care about, all the way up into people in their, elderly populations. So how do we reach those people, and how do we make sure they're getting the information that they need? Where do they go? We certainly have people that use traditional, or what we call legacy media, television, newspapers, radio stations and things like that, particularly when you're thinking about health events. Weather is a great example. When they're talking about a very warm day or a very cold day, is it going to rain today? People go to the radio, and they might listen to things like, to find out what the weather's going to be like today. But also, obviously, we have social media channels. And who are people using for the social media channels? Who are people following? What are they trusting? And what kinds of sources are they trusting? And then also, let's think about other sources where people might get information that aren't considered what you would say media per se. And we say community centers, senior centers, libraries, people that don't necessarily have as much access to media online, etc. They may go to a more traditional site. So how do we reach them? Those are the things we think about when we're going through what to do and how to prepare for this. So now I'm going to kick it back to Dr. Vale.
Thank you. One of the things that we always need to look at is, what is the health literacy of those audience members? How do we engage them in a way that makes sense to them and that they can understand the information being provided to them? If you look at the National Assessment of Adult Literacy, know that very small percent of the population is proficient at understanding that health information. You have intermediate is the majority, but then basic health below basic. And that does tend to align with where they get their information. So adults at the higher end with intermediate proficient skills, they tend to obtain information from written sources. So more likely to go to the newspaper, more likely to go online and read more in-depth stories. Adults with basic or below basic literacy, they're more likely to skew into radio and TV, where they're not having to read and go through heavier words. You'll also find, especially with the elderly, some get to a point where they can't read, that it just becomes more of a struggle because of eyesight, because of just having to sit in certain area for longer time. So they tend to watch more TV, to follow more media that is audio or visual from that standpoint. The biggest thing is that now we know that 86% of all US adults get their news on some kind of digital device. Looking at the audio side of things, 28% are now listening to at least one podcast a week. What could you be doing in your office in order to engage some of those individuals? And for better or for worse, 53% of Americans today get their news from social media sources. So how are you engaging not just social media, but even the media on social media? And that's an important thing to consider here too, is that if there are certain journalists that you're engaging with in your community and they're on social media, especially in smaller communities, there's going to be a lot of people. And if they provide your information or you're linking to their information, it's going to build your community and build your following of your own information because you're starting to share sources. So you have to think about how your media contacts want information from you. How does the outlet like to receive news releases? Straight on email, as an attachment, pick up the phone, give them a pitch. Will the radio station in your area play a PSA? What social media channels are your beat reporters on? Who do they follow? And for the most part, reporters want those bigger numbers. It's good for them to have a strong following. So if you follow them, chances are pretty good they're going to follow you back. So think of how you can engage them in that relationship online. And the benefit of the social media is that your message goes straight to the audience, but it can also get to that audience through the media's social channels. So if they're following you, you share something and then they share what you shared, it's going to continue to expand the reach of the information you're putting out. Oh, you're muted.
Sorry, we had noise in the back. Sorry about that. I think to kind of follow up with what Dr. Bales is referring to here is that idea that think of how instantaneous that is. If you're providing that good information and the journalists are sharing that, that's helping them do their job, but it's also helping to get that message out in the words that you actually want to use, which is fantastic. In terms of thinking about journalists, I mean, journalists have some just to give you a little background, when journalists are thinking about stories and how to and what kinds of news they want to produce, they think about some general tools here, general ideas. Timeliness, is it happening right now? Proximity to them, so depending on where their kind of audience, geographic audience happens to be, the significance and then also human interest. And human interest could be anything from an individual having maybe a very rare, say, monkeypox to go, on the real kind of concerning end, but also on the positive, somebody who has beat cancer for the 6th time. And I mean, I know that's kind of also has some negative connotations to it, but at the same time, I mean, we're looking for positives and negatives. And journalists, when they're thinking about these stories, they're thinking about their deadlines, and the deadlines, they used to be daily. Now they're obviously kind of instantaneous, but again, journalists are expected to produce X number of stories in a given day, in a given week, in a given month. So they have deadlines that they have to focus on. So the 6 o'clock news, for example, doesn't start at 6:06 because they couldn't get a source. That's, they have to come up with something. So being is helpful and responsive, knowing those deadlines is really important, because they're more than likely going to run the story, even if they don't reach you or somebody in your office, but they're going to find a different source who may not have the same message that you do. It may not give them the expertise that you can give them. So it's important for you to be, and I use the word you collectively, your office, your group, to be able to share your expertise to make sure your message is coming across. One of the ways to navigate that with journalists is when they call, or they reach out to you, try to get a sense of what is what are you thinking, or what are you looking for here? They may call you with one question. Hey, I just have a quick question about a story. It helps you to have a little more information if you can get, say, can you give me a basic topic, a basic idea, and then I can, and maybe give me 15 minutes. And if you negotiate that 15 minutes or 10 minutes to call them back because you want to do a little research into it, because obviously you don't want to, cold calls are difficult. do call them back, make that a priority. That 15 minutes may be all they can manage before they're going on the air or whatever. So, calling them back the next day is a little rough. So, it's good to think about, how can I make this the priority right then? And again, that is a challenge for those of you that have, 14 million things on your plate on a given day. But I think over time, as you negotiate that relationship with the journalists, it will be a little easier to work out how you might do that. Some journalists will take email, will take email responses, things like that. Some do not want to. But again, the other thing I would offer is make sure you're giving them almost more information than they're asking for. So you might suggest, hey, here are 2 sources or 3 sources that you might look at to negotiate, because they may be a little bit busy that they aren't able to get to that particular thing right then. So the other thing I would say is try to give them full statements. Try to give them a full sentence. So if you work it up so you're not kind of breaking up and saying, oh, well, there's this, there's this, there's this. Think through, kind of fully fleshed out statements if you can, and that's what that extra 15 minutes can give you. But also, link to social media, link to infographics, provide them information that they can use in different formats. They're providing stuff that may be on websites, that may be in a printed copy, it may be a visual. So look, using different kinds of things that you might offer up. If they want some B-roll, and if you're not familiar with what B-roll is kind of background roll. So it may be, here's a picture of our new building, so you walk them through the new building as you go through, or here are some of the wildflowers that are particularly noteworthy for providing allergies and or for giving some allergies and pollen and things like that. So those are things that can help them give more information to you as you're doing your particular thing. So we wanted to give you a quick example of how this might shake out in terms of providing resources. And so obviously we got a lot of heat going on right now. So we have major heat waves, and you likely get a call from somebody. What are some of the public health risks that we need to be concerned? Well, I mean, certainly you can answer his or her question and say, we have X number of people that die each year from heat exhaustion, heat exposure, they're hospitalized. But it may be smarter, or it may be more beneficial to you to go a little bit further here. Nebraska gets, weather in the 90s and each year. I mean, we obviously have a lot of this heat wave each year. So maybe we get a media kit each year before, towards the end of spring, before the heat comes. So we're ready. And so when they ask for that question, because we know it's coming, the same as winter will come as well, we can have those sources ready and have that information ready and just fire it off right then. That's a little way to do it. We might be able to develop some more, some video that goes with it, or even kind of some sound bites that some of our experts are available that can say before they even have a chance to ask, we're able to provide that information. And again, the kind of the ideal best practice, if you will, is you already have that relationship with a local journalist. So you're following them on social media, they're following you, and you can share some of that information before they even start. And again, you're commenting, they're commenting, you're sharing resources, and just, even though it's only 80 today, that it's going to be 98 next week. So why don't you put out a tweet now saying, or a Facebook post now saying, we know it's coming, time to prepare. The term I came up with was you even want kind of a sound bite that might work out. And the term I came up with was when the sun's up, you lather up, with your sunscreen or something like that. So those are some of the ideas that you might work on. So those are ways to negotiate it across the board. So, and again, one of the things we want to share, particularly with some of the rural areas that have very small public health departments and small areas, you don't have to be the end all be all source for everything. Newspapers are actually sharing resources across the board. So newspapers across Nebraska, across the country are sharing resources because they're owned by by companies, roughly some of the same companies own multiple newspapers. So they are sharing resources. One of the things you can do is start to figure out where are they getting those resources, and figure out who, across Nebraska, maybe, this count, maybe one county, and forgive me, I'm not as up on Nebraskan counties yet. I will be. Next time we do this, I promise I'll be way up on those counties. But, you know, one county department may focus on heat. One county may focus on what it means for crops. One county may focus on, again, snow removal and you know, concerns about related to frostbite and things like that. So again, if you share those resources, then you've compiled them and say, "This, I'm going to take the lead on this story. You're going to take the lead on this story." And if you're sharing that content, then I can share it, then you can share it, then the next office can share it. And again, you've been able to share those resources, but also get that message across to a larger audience, which is really important. I also want to note, just again, track the number of media inquiries that you might have. That's kind of a good element to think through. And then finally, I'll just say, in terms of the kinds of, when I say track the media inquiries, what I really meant by that was just how many times are you getting calls? And is it a call that you can refer to different kinds of people? So, I mean, you might use somebody from the hospital, the local hospital, you might use somebody from the local schools, things like that. And then finally, I just wanted to mention kind of what kind of messages, when I say message, what does that really mean? Well, I mean, a message itself needs to be, again, short. I mentioned the "when the sun's up, lather up." You know, that's kind of a short soundbite that might work very well, and you can share it across the board with, let's say you're sharing, oh, we're going to have temperatures in the next, you know, for the next 5 days, we're going to have temperatures that are over 95 and the heat index X, Y, and Z, and then say, hey, when the sun's up, lather up. And again, I'm not selling that particular phrasing, but I think that will help to get your message out there and make it resonate and help it to resonate. And the journalist will pick that kind of thing up. An anecdote or some kind of a contextual element will also help make that resonate with the audiences. So those are important. And again, action steps. I think we often talk about talking about the problem of, oh, it's going to be very hot, but okay, what do we need to do to manage it? Make sure we're drinking water, make sure we're doing this. Those are positive action steps. Where are places that free water is being given out, for example, or where can somebody go if their air conditioner is broken? Are there shelters that are going to be available that somebody can get some relief from the heat? Provide, explain the risk, and then give some tips on how they can work with this issue. Because again, nothing, and again, coming up with the buzzwords will really be a helpful thing. It helps people remember and resonate. So I heard there's a question, so I guess I don't know if it's for me or for Dr. Vale. So
I think we'll start with you, Dr. Armstrong, and Dr. Vale, please jump in as well. You were talking a little bit about, you had the you could do this in your response, but you could also do this or be even more intentional and do this. You kind of have your good, better, best piece. This person, Shana Cooper's asking, if public health officials don't have the time or staff needed to create media toolkits, what are other ways that they might manage getting ahead of information with the media?
I'll actually jump in on that one, just because working in that space, at least with the CDC, the amount of material that is out there that is available for use in public health offices are pretty significant. So part of it is just going through and identifying within the calendar year, what are hot topics that are going to come up. And that's where when Dr. Armstrong was talking about sharing resources across, so I think we have a regional group here, right? Multiple states who are part of this. You all are attending conferences together. You're engaged in events like this. So looking across those regions, who can take what area? And think of, okay, we use the example of the heat wave coming in. You'll have allergies that come in during certain seasons, right? So we're going to have severe weather coming up. We'll have aspects of cold. There's going to be, as we're looking at emerging diseases, we're going to have flu season, right? These are all things that are coming. So it's identifying the resources that are already available to you. You can use them. They're free for you to use, to download, to package together. At least in the work that we had done before, CDC was not caring whether or not you added your brand to it, as long as you're pulling the CDC's information as part of it. It was making sure that you were sharing information from credible sources. And even on the social media side of things, if you're following folks from the World Health Organization, folks from the CDC, larger public health offices that have a staff of 3 or 4 people in the communications office, follow them because they're putting resources out. You don't even have to create them. You just hit share, right? So then you're still the credible source to those who are following you, because the local journalists in your area probably are not following them. If you're passing on that information, as long as it's always coming from a trusted source, you're now the new source of that information, even though you shared what was there before. And remember, the bottom line, the focus is on protecting the public. If the information is good, don't worry about claiming it and branding it for yourself. Just make sure that it's getting out there to the public so that they know that you are a resource for the latest and greatest and most important information in order to protect your community. That was my little rant. You want to talk about it from the journalist side of things?
I mean, I actually think what you said was very important, and I think that's kind of it's also one of the, it's kind of a mindset difference to think about it from a journalistic standpoint. And what I mean by that is as Dr. Vale said, certainly we know these things are going to come up. So when you're looking at your Twitter feed and you're looking at your public health sources and you're looking at, you think, oh, this might be something useful because I know this is going to come up later on, and I grab it and put it in a file, you know, that I have for later on. So, I mean, it's a matter of when it comes across, realizing what are the different ways I can use this information for my own audience members. Is it, you know, I certainly can use it to create my own, to do my own work, but I can also share it with my audiences. And again, so it's really just a file that says, oh, you know, let me keep a file on hot weather or crop, different things with crops and tornadoes and things like that. And then being able to pull it out when it's time. So, I mean, I think that's really what reporters are doing, because you're exactly right. They're not following them. So they think about it when a crisis happens. So you're saying, oh, well, I was prepared for this crisis. Here's my file. I'm ready to go. And that's an easy thing to do. That's going to take you maybe an extra 10 minutes of your day, you know, as you're going through your sources to figure out what kinds of information you have, because you're looking to figure out what kinds of issues, what health issues have come up overnight or the last week, et cetera, like that. So that's how I would approach it.
I'm imagining similar to a holiday cookie exchange, but you've got your media exchange happening at next year's NACCHO conference for all of the local health departments on the call. One more question sort of related here. What if you're not getting a lot of media inquiries? Is this good, bad? What should you be thinking or doing?
I mean, how do you be more proactive? So I think that's a great question. Is it because we certainly in some of these states, we have some what they call news deserts. We don't have a lot of news in those areas. We don't have a lot of news sources. We have news, but we don't have a lot of sources to get that news and get it out, the outlets. So where are your closest outlets, you know, within your agency, and how can you reach out to them, and how can you establish that relationship? Maybe it's I'd like to really establish this relationship. I'd like to talk to you. Maybe you have a half an hour meeting with them and you say, what kinds of things can I start giving you? So you proactively develop that relationship. Journalists are never going to say no to somebody who can give them information, because they're going to need it. And your job it's kind of making the pitch. It's how do you say, hey, we really need to worry about this county. We really need to worry about this issue. And a journalist is looking for news. It may not come up tomorrow, but it's going to come up on what they call slow news days, you know, when it's kind of the end of the day and they say, oh, it's, you know, this is the kind of time of the year when I don't have a lot of news. Hey, this is something I've been thinking about. Let me put it out there right now. They call those evergreen stories. So they're always available for you. That's why they call them evergreen. And that's once you make that connection, the reporter will remember you if you were responsive and thoughtful and communicative with them.
I think the key piece for this is that you have to go to them, especially in smaller communities, more rural communities. They're covering what's happening at the local high school. They're covering the day-to-day, maybe city council, maybe. To look at another office out in the area, unless there's something really big that they need, they're not going to go to you. So you have to go to them. And again, if your bottom line goal is to protect the public, you should be going to them, because you can have all the best information in the world, and if nobody knows about it, it doesn't matter. you're not actually getting out into the public.
So this is just a brief, just a brief example. This is a news release that comes from the state Department of Health and about their suicide prevention line. And really all I pulled it in was just to say what they've really done is reiterate 988. And so, I mean, if you see in this news release, I kind of circled and highlighted the number of times they mentioned we have 988 work groups, 988 advisory council. That's what you're creating the buzzword for, so that there's the element of people will remember this when they would need it. And that's a really simple kind of way to do it, but it certainly is effective because I certainly remember that.
Okay, if there's other questions tied into more of the pitch and following up with the press releases, please throw them in there. We're going to switch a little bit over to the interviews side of things. So what happens when the reporter calls? Speaking clearly and not getting choked up in the middle of it is important too. But the key piece is that you are avoiding jargon. Speaking, remember we were talking about health literacy levels, making sure that you're communicating in a way that people can understand. Don't speculate on what others are doing. Even if you're asked to speculate by the journalist, focus on what you have control over, what you are providing. An important piece is to correct misinformation in questions as well. So we'll have an example here shortly where the question is asked, the information they had wasn't right in the first place. Don't just answer the question. Correct that information. Make sure that you're not just responding instinctively in a defensive way because, oh, well, they don't even know what they're talking about. So now I got to just respond to that immediate question. You have control over what you're saying and what those key messages are. It's important to practice on camera. And the hardest part is to actually watch the recording. So I know we have some training coming up. Some of you may actually be part of that if you are students in the public health program at UNMC, where we'll go through full exercises. And this is stuff that we have done for a program that we've run for the military, working with Army captains before they have a journalist embedded in their troops. It's working with CEOs, working with those who are going to head up the comms team, making sure that you go through an exercise that is realistic. So we're going to be working with the College of Public Health to identify specific examples that you may face. And then you'll be hit with that scenario and be asked to respond to media questions. And then go back and watch that video to see how you respond, how you engage, whether or not you have the tics of whether it's twisting in your chair and making noise, all of that can distract from your ability to be a good source of information. Key pieces, don't let others speak for you. So this was the example I mentioned. So Jill Jones says the health department refuses to give out baby formula for her baby. Well, we know that the health department is not providing baby formula right now. It's not something that they do, but you don't respond by saying, we don't give out baby formula, because then it becomes a different clip, right? That soundbite is different. You respond with the health department is working with their local food pantry to connect families to resources in the community. Stick to your key message. A scenario that we've worked on in the training before, we were going through the example of the cantaloupe and listeria. And it was the respondent was trying to minimize the concern around the situation. And by trying to minimize that, the reporter in the exercise fired back saying, oh, so public health doesn't care about dead babies? And while they didn't know the journalist, right, this is an exercise, the respondent in the exercise said, of course, public health cares about dead babies. So now you have the public health rep responding using the term dead babies. And now it's an audio clip that can then go on social and then can get replayed and replayed. So being careful not to be defensive and respond in an exasperated way, just keep to what your key points are. And if you make a mistake, if you say something incorrectly, stop talking. Say, I'm sorry, that was incorrect or inaccurate, because the journalist doesn't want any inaccurate information in their story. So stop, because now you're ending that soundbite. State that it was inaccurate, correct the information in a fresh statement that can be a fresh soundbite. Do not try to talk your way out of the ditch. And that's what we see a lot when people get nervous. They'll realize that they're going into a bad direction and they'll just try to keep talking to get themselves out. So identify the key word in the question you can tie your key message back to. Make sure that you are laying out the facts and keeping it simple. Remind them of your purpose, which is to promote and protect public health. They want to be part of that. So just a quick example of how this has played out in foodborne illness. If you remember the egg recall study, we actually analyzed media. We looked at stations all across the nation, pulled out different aspects of the messages that were out there in the midst of this crisis. We coded the messages for instruction for public protection. We went to subject matter experts and asked specifically, what are those key messages for self-protection in this particular case? So then we coded for all of that. These were the individuals who provided official statements in the midst of that first week after the crisis. Look at little public health there with 2%. In that area, it was a big national crisis. So there was a lot more of FDA, CDC, USDA. You actually had those who were involved in the egg recall. But very little information got out that was focused on the actual instruction for self-protection. Those are those blue marks there for all these different areas of instruction. And those who provided the instruction, 72% of the instruction that was provided came from the news broadcaster, not from those who are providing official statements. So keep in mind of what is your purpose? Why are you there? What is the most important thing to get across in any situation, whether it's a regular day and there's something happening in the world that you want to make sure that your public knows about, or you're in the midst of a crisis, we're in the middle of, how are you to the public and making sure that that's prominent in putting out? Another point is that it is easier for scientific news to pass through gatekeepers if there's that prominence, importance that Dr. Armstrong talked about at the beginning, right? That it's newsworthy in order to get that scientific information out. And the big challenge is, even in studies where they have compared two very similar health risks, they found that the media either regurgitated absolutely everything that was in the press release, or they sensationalized the information provided. And the challenge is, you can't control either. You have 0% control over what they run, but you have 100% control over what comes out of your mouth. So only give those good sound bites. Your goal is to become a trusted source who consistently provides clear explanations of risk and instructions for self-protection. And if you can always be that resource for the local media, that's going to make your job so much easier. And it's also going to protect the public who you are set out to protect. So we are right on for opening up some additional questions here. And I'd also like to hear from you too. I mean, what's limiting your ability? We know staff time, all of that is an automatic. What else? For a long time, we had public health departments who weren't even allowed to use social media. We've come a long way, but not in all areas. Think of one thing that you could do to improve your media relations. And then the last one I'd throw to you, what do you wish we'd covered that we haven't here today?
While we wait for those questions to come in, something that's really hitting me right now is when you're talking about some of the interview things and being careful what you say. And man, those are really transferable tips you are giving, not just to media, but to our people we're bringing in as new partners in our work, to the other systems in our counties and jurisdictions that we're trying to work more closely with, or that we need good relationship with, to when we're standing in front of groups of any kind, whether the media is there or not. So I'm just thinking about how those questions are coming across. So someone's asking, what tips do you have for getting over the nerves? And they put it in quotes, not me, looking calm.
Practice. It is practicing in front of the mirror. It is recording yourself on a camera and watching it back. That's a big part of it. I'm watching through, you can torture yourself and ding yourself for every single and like that you do. I mean, can really push on some of that. But for me, it is, why am I here? What is my ultimate goal? And if my ultimate goal is to protect the public and I'm coming from a position of care, then it's a conversation. If my goal is to look good and not embarrass my department, that's a different goal. And it's going to add anxiety around what you're saying, where if you keep it focused on the conversation and what's important at this moment, that'll help with some of that anxiety too. And then it's just practice.
Yeah, I'll just add to that I'm not the best public speaker. I mean, you probably noticed that in the last 40 minutes. And one of the things that I do is I write things down. I'm a much better writer, so I have a statement that I want to write down. And I mean, especially with those buzzwords, you continue to go back to them. So even though you're nervous, you have that, just always look back and, okay, how do I phrase this back to what I was trying to say? So it's kind of you don't have to answer their question directly. You can always just get that word back in there. I mean, I'll continue to hit that, because the more you say it, the more likely it is to actually get in there. And again, think also about other ways you can phrase things. So through social media, you can always follow up through your own writing, through a press release, etc. I think those are really important.
So got a couple of questions here about social media and disinformation. One is, how do you interact? What are your best pieces of advice here for interacting with social media trolls?
Not interacting with them. You don't delete their comments. You let them hammer away and you'll get to know who they are pretty quick. There's no point in having an argument. You're not going to change their mind if they're, and especially if it's a troll where they've set up a whole network so that they're firing off, because you can create a bot that's sending the exact same awful messages to multiple social media accounts. It's getting better, especially on Twitter, it's getting better, but you can't control all of that. And the real people who are just dragging on you anyway, you're not going to change their minds. So let that piece go. How you're going to solve the biggest piece of it is expanding your network to increase the number of people who trust you and who are engaging with you in a positive way, to be able to watch that, because they will actually start to interact for you. And we had done a study with the CDC. This is during one of the many bouts of fighting on vaccines. And there was a whole line of trolls on their Facebook page that was going through and talking about, oh, well, this causes autism and it causes this, and this is why we shouldn't be doing vaccines. CDC, as an official respondent, never commented on a single one of them. But the public health advocates who follow the CDC, man, they were on top of those trolls, left and right. So if you build trust within your community will actually protect you and respond for you, so you never have to engage.
Ooh, man, it's so hard not to get my fingers going when I see those comments. Okay, here's another one around misinformation. A huge media challenge that became apparent during the pandemic is misinformation. Do you have any advice for an effective way to address misinformation when you see it or hear it in the local media?
Hopefully you already have a relationship with the local media, and then you pick up the phone and you call the reporter directly and you explain, hey, I saw this. Just want to let you know that's not correct information and could actually be harmful if people are buying into that hysteria, whatever it is, buying iodine pills or salt pills or whatever the latest thing on Amazon is for you to buy, and protect yourself from whatever it is. Make sure that you have those relationships. So when you see incorrect information in the media, you follow up, because your job is to protect public health. So then you should be advocating to make sure that the correct information is going into the media. And for the most part, if we're talking about traditional legacy media, even if we're looking at those who are even mommy bloggers, I mean, think of media broadly from that standpoint, they want to provide correct information. Now, on the other side of it, you may have media personalities, do not have a degree in journalism, certainly not from the University of Nebraska in how we train journalists, who are going off and are truly sensationalizing in order to create a political movement that they're gearing people up. That's a different area. That's where you actually work with local media to make sure that the correct information is going out, because you can have them, again, become an advocate for the public, which even the mission statement within our college is aligned to making sure that we are upholding the ethics of journalism, that we are trying to uphold democracy. That is the role of journalism. And good, strong journalists will make sure that that their public is receiving information that protects them.
Someone's asking a question about, monkeypox is there right now in the media. Can you talk a little bit about how you think the media, specifically kind of the major TV outlets, media outlets, television, is handling monkeypox with respect to the LGBTQ community? And I think you can also think about this broader when we're thinking about the media specific topics and specific communities being impacted by those topics.
I think one of the challenges that comes up here, and I'm going to answer this in a more broad space, because I don't know that I have viewed enough of the monkeypox coverage to be able to address that specifically. But I think one of the things to think about is the level of inclusiveness and how we address it. Is there are so many communities that are, and so when I say communities, I mean sub-communities, some groups, some social groups that have different needs. And how do we address those needs based on the different subgroups? So media, one of the pitfalls of being a journalist is that we tend to want to get a phrase set out, put out as quickly as possible. So we tend to categorize people, and as a result, we don't think about individuals. We think about larger groups, men, women, and again, within men and women, there are obviously all kinds of variations, and that's a challenge. So as a public health professional, I would think the way to approach that is really to say, to really try to specify the needs of this group may be different than the needs of this group. And again, but you also have to think about, you don't want to, and especially in a small town, really isolate, in a way that identifies people individually as opposed to collectively, because again, smaller groups with specific needs have different challenges, and we have to protect their privacy as well. And I think the way to think is to use the words, be inclusive, and think about, okay, and I'll use the weather element here. You should evacuate because there was or take shelter. You should get to a covered area. Well, not everybody is able to evacuate an area in a weather related event. They have all kinds of needs from animals to take care of, to elderly parents that they have to move, and they don't have the resources, the financial resources. So how do we answer those questions for them? Meaning, how do we give them resources that are going to be useful for them? Because evacuation is not a possibility for them. And I think that we need to think about how we address those. Now, that's not really an answer per se, but it is a way to think more broadly and give the idea that, hey, not everybody's going to fit into this small category that you've given. How was that for not really answering the question, but yet giving you some more things to think about?
I was just going to say, sir, it gives a lot more things to think about in how we're crafting our messages too.
I'm thinking too of when we're throwing out the disparity piece of it, and I think that's where it was tying with the monkeypox piece. Well, it's really growing in this community. Anytime you do that without having the studies behind it, we're looking at essentially targeting those areas. And even if your gut reaction is to say, hey, we have to be careful here, this community has gone through this before where it got tied in, that can actually bring more attention to the story when it shouldn't be there. So go back to, why are you here? What is the purpose? What is the true information that's going out? Even though you recognize that it's affecting different areas, you can communicate those areas in different ways. One thing, the challenge and the opportunity that's in the changing media environment now is that we had very selected media sources, right? So think of individuals in different community groups, as Dr. Armstrong was mentioning. How do you get to them with messages that are specific to them that don't necessarily have to go out to everyone else? And even how you segment the media, segment those messages for different audiences can actually improve public health and improve how they are treated by others in society.
If you're going back to what we talked about earlier in terms of audiences, knowing where they get their news, remember that's how we kind of started out. Well, there are, alternative media, there are African-American media, there are LGBT related media that you can reach out specifically that might reach a particular population that you're trying to reach. And maybe that's, again, is just going to a senior center. So there are ways to be very targeted in that.
I am looking at the time. There are so many good questions in the box right now and not enough time to answer any of them. So I'm hoping I can send them to the two of you and gather your ideas and feedback, and then we can send them in a post-call email if that would be okay, out to all of the registrants, because there's some really good ones in there. I want to know the answers to too. One, I'm just going to put on the top of your head as we walk out here, any samples or places of some well put together media kits. So just to get you thinking about the kind of questions coming your way, and some questions about plain language too, and ideas around plain language. Public health has so much jargon in it. So anyway, those are a couple of the examples of a good 5 or 6 questions we have that we don't have time to get to today. I'm so excited. This has really created a buzz. As you can see, people are really seeing the need for this kind of thinking and work and intentionality of paying attention to how we're communicating about our work post-pandemic. So thank you so much, Drs. Vale, Dr. Armstrong, for your time and expertise on the call today. My goodness, I'm walking away with a lot of good stuff. To everyone who's participated on the call on behalf of the Office of Public Health Practice and the Midwestern Public Health Training Center, thank you for attending our Sizzling Summer Series Session 2. We are very much looking forward to Session 3 in August, which will provide participants with concrete skills for building bipartisan support for public health efforts. So be sure to bookmark the webpage for our Sizzling Summer Series, where the August registration link will soon be available. And there's also a link to our recordings for our first session, as well as a link to this recording will be available soon there as well. And they had such great things to say, Drs. Vale and Armstrong, about don't talk about jargon. We were just saying that near the end. Don't forget that new book coming out from the de Beaumont Foundation, Talking Health, I believe is now available or will be very, very shortly. So another resource at your fingertips to continue the conversation for today. Thank you also to everyone for completing that evaluation after the call. It'll be sent in the next 24 hours. Look forward to seeing you all in August for Session 3. One more big thank you to our experts from UNL for joining us today. Take care, everyone, and we'll see you in August.
Thank you.